Good afternoon, everyone. Thank you for being here at Revere City Hall to celebrate National Donor Day. We are extremely proud to welcome Matt Boger and New England Donor Services to the City of Revere. Thank you for the tremendous work, Matt, that you do in coordinating organ and tissue donation here in New England. I'd also like to thank the Massachusetts Registry of Motor Vehicles for their participation today. It is their work that facilitates this critical service, allowing us to make a choice today that can positively impact so many other lives in the future. I've had the privilege of speaking with and meeting three very special people who have had their lives touched by organ donation. Bob, Caitlin, and Carol have graciously offered to share their incredible stories with all of you today, and that is in the hope that our neighbors all across Massachusetts will be inspired to register as organ donors. For those of you who don't know, I also have been personally touched by organ donation, and excuse me if I lose it a little bit, but in July of 2014, my dad got a double lung transplant, and he was given an extra 2 years with us. He passed in July of 2016, but in the 2 years that he was given, he got to see three incredible things happen. He got to see my wife and I get married. He got to see the birth of my first son. And he got to see me get elected mayor of this fine city. So those 2 years really were a lifetime. And it certainly brings the importance of organ donation and tissue donation to my family and to me personally. So today, in Massachusetts, there are more than 3,000 people, people like Bob, Caitlin, and Michael, who are awaiting a life-saving organ donation. And we all have the ability and the ease to support them. And we do that by enrolling in the Massachusetts Donor Registry when we apply for or renew a life-saving organ, when we apply for or renew our driver's license with the RMV. The little heart that everyone gets, you know, I've got it here on my license, but the little heart that you have on your license really does give the gift of another chance. And in my personal opinion and in my personal experience, it gave my dad an extra 2 years of life. And it gives another chance for someone whose life still lies ahead of them. So I can't think of a better way to celebrate Valentine's Day this year than to make sure that you've got that little heart on your Massachusetts ID or on your license. And with that, I will bring up Matt, who will tell us a little bit more about what becoming an organ donor means, not only for the donor, but for the lives of so many others that it touches. Thank you, Matt.
Thank you, Mayor. Really appreciate it. Wonderful job. Mayor, thank you so much for your wonderful leadership and sharing your personal story of individuals being touched by donation. What we're here to talk about is really time. We want to extend the time of individuals who need a life-saving transplant and extend the memory of individuals who've passed away. The idea that Valentine's Day is here and the heart. If you have a heart, we encourage you to register as an organ and tissue donor. As the mayor correctly stated, we want to thank the RMV and Erin Devaney for the wonderful work she does. 99.8% of all people who register do so through the RMV, and we want to thank the mayor and his wonderful office here in Revere. The Revere RMV does a fantastic job voluntarily asking that question. Would you like to register as an organ and tissue donor? That's, again, a voluntary question. You can say yes or you can say no. That being said, it is not a neutral question. Both the state and federal government strongly supports organ donation and provides the easiest mechanism to register, and that's when you go to the RMV, where about 70% of the population voluntarily goes to get an ID or license. I also do want to thank the Department of Public Health here in Massachusetts. They've put together this wonderful campaign to register as an organ and tissue donor. If you are not at the RMV, you can go online at registerme.org/MA. There you can identify yourself as an organ and tissue donor. The Department of Public Health correctly identifies that you can register at any age, 60, 70, 80, 90 years old. We want you to say yes to organ donation. We don't want anyone to pass away, period. The gift of life's important. But sadly, if you've passed away, there is that opportunity to help save a life. And we are here today with some amazing individuals here in this wonderful community of Revere to share their personal stories. Again, the idea of having a heart, and put the chocolates away, put the roses away, go and register as an organ and tissue donor. That's what truly means by being a heart. But I want to introduce Revere resident Bob Sawyer, who's here today because of this wonderful story, and I really appreciate him sharing his story. So Bob, thank you so much.
Thank you. Hi, I'm Bob Sawyer. I want to tell you a little bit about my history, at least, and how a donor impacted me. I had survived cancer as a kid when I was 18, and part of that treatment, I had a lot of radiation and chemotherapy, but one of the chemotherapy drugs ended up damaging my heart muscle, and this was back in 1986. I lived many, many years maintaining things just fine, but got to February of 2017, and my doctors realized that, I'm running out of medication options, and I had never considered the idea of a transplant. And they brought it up, and it frightened me. I didn't know what to think about it. And I didn't really realize what the full impact of what the donation would mean to me until I got to that moment during a long hospital stay. I had been admitted on July 5th, 2017, so they could help support my heart while I waited. And then I got the phone call on October 20th, 2017, and I remember that morning very clearly as my attending said to me that he had found a donor heart had been found. And I can't really put to words the range of emotions that you feel knowing that an organ donation is being made to help me live. I cried for the donor and their family. I cried for myself, not knowing what the next 24 hours would bring, but at the prospect of a new life and being able to continue contributing to the community and to my job. I got the transplant early on the 21st of October. It's like 1 a.m. in the morning, and began my recovery. And I can't say enough about the donor. In terms of helping me, it was somebody who didn't know me. And I say 1,000 times thank you. I sent letters to the donor's family. I heard from the donor's mother. And I'm grateful that they were able to make this gift so that I could live. Now, currently, I am volunteering with New England Donor Services, and I'm the Revere ambassador for the RMV. And I will be stopping by there actually next week, I think, on the 20th, to thank everyone for asking that question, would you like to be an organ donor? That is extremely important, and from my history, I can't say enough that organ donation does save lives and helps a lot of people. Thanks.
Bob, thank you for sharing your powerful story, and thank you for being here. You're a wonderful example, because if you saw you on the street, you would never know that you received a heart transplant, and I want to thank him so much as well. He is a very busy man, working a lot of hours, and he took time today to be here to talk about that, but it also shows that that gift of a transplant, almost automatically people feel better, and that's a wonderful gift. And for you to thank the donors is so important. I'm so pleased also to introduce Reverianites. I'm not sure how you... Reverites, sorry. I want to make sure I have that term right, Mayor. Thank you. Evelyn and her wonderful daughter, Caitlin, have got just a fourth grader here at the Hill School, and we want to thank the Hill School for being here. Have an amazing story to tell. So thank you so much for being here, guys. Come on up.
Good afternoon. My name is Evelyn Platas, and I've been a resident of Revere for the past 6 years. 2 years ago, my daughter Caitlin, who's now here with me, was listed for a heart transplant, and at the time it was really hard, and we felt very helpless, knowing that our daughter needed a new heart. Children's Hospital gave us a call 4 months ago. She had surgery. She received her new heart. We are very grateful for the wonderful family who donated a new heart for my daughter Caitlin, who's now 9 years old. 2 months later, she was able to go back to school. She is now back to her normal life, and all I can say is thank you to that wonderful family. We can't say enough or thank enough for this wonderful gift that was given to us for our daughter. We also want to thank Children's Hospital for helping us through all the process and give us the best assistance ever. We also, me and my family, want to encourage everyone to register as an organ donor. Personally, that it's very important for us since we were gifted by the Organ Donor Association. Thank you, everyone. You want to say something? No?
Thank you so much. First of all, those dimples are fantastic. So that is wonderful. And Evelyn, thank you so much for sharing the story. And Caitlin, we are all better off that you are here. So thank you so much. You are, got a fourth grader myself, and you are as energetic and positive as he is. So thank you for doing that. Again, the idea of a gift, the greatest gift you can give is the gift of life. I do want to indicate that organ donation is very, very, very rare. You're actually more likely to need a transplant than to become an organ donor. So we encourage people to register. The likelihood of you becoming an organ donor is very low. Only 2% of all deaths happen in a manner where one can become an organ donor, and that needs to happen in a hospital setting. So it is a case that does not happen a lot. We've got so many wonderful volunteers that share their personal story. I'm so glad to work with a friend of mine, Jim O'Hare, who's here to share his story as well, with a connection with the mayor as well with the lung transplant. So Jim, if you don't mind sharing your story.
Hi, everybody. My name is Jim O'Hare, and I'm very happy to be here today. Very happy to be part of this organization and this effort. Mainly, I don't live in Revere, but I've spent a fair amount of time here. When I was working, I was part of the group that built that Hampton Inn down on Route 1A, and I spent a lot of time working with Mayor Ambrosino and the different departments and agencies. I was doing great in my life up until around 2011. I was very active. I ran, I swam, I bicycled, I cross-country skied. Anything that I wanted to do, I could do. And then all of a sudden, I started to have trouble breathing. It just came out of nowhere. And the illness is called idiopathic pulmonary fibrosis. Idiopathic meaning no known cause. A couple of years of treatment through medicines that didn't really go anywhere, and I met the doctor in July of 2013, and he said to me, "I'm out of tricks." the only solution for you is a transplant. And that started us on that road. And I wound up eventually getting listed by the Cleveland Clinic in Cleveland, Ohio. We had to go back and forth a number of times, and they evaluate you. And what they're really doing is looking at the likelihood of your strength carrying you through the operation. It's not exactly a walk in the park, but everything came together. And on the night of August 7th, 2014, I received the call. My partner, Ann, and I had moved to Cleveland, Ohio to be close to the hospital when the call came. And I went in that night, and early the next morning, I had my left lung transplanted. I only got one. Over a certain age, they kind of discriminate a little bit and give you one and not two, but I wasn't going to argue. I was happy to get what I could get, and my life has just opened up tremendously. Since that time, before that, I was at death's door. I couldn't do anything. I won't bore you or go into the details of how I was living day by day, but take my word for it, it was very, very limited. So I'm real happy and fortunate to be here. I'm especially fortunate that whoever my donor was had the foresight to, in his residence, sign the papers that made him an organ donor when he passed away. And just thinking about what Matt said, even though we have a very high percentage of people that register at the registries, there's still, I think, only about 52% of the people who could register overall are registered, not just the people that do it at the registry. So everybody has a chance by just going to registerme.org. It takes about 30 or 45 seconds to fill out the form, and then you're in the data bank, and you'll be there forever, and you could be saving someone's life. Thank you very much.
Wonderful job, Jim. Thank you so much. And you are correct. The need is great, and only 50% of individuals in Massachusetts who could be registered are registered. We work very closely with the RMV to voluntarily ask that question, would you like to register as an organ and tissue donor? Our idea is Massachusetts is a very giving state, and actually about 4 years ago, that rate was about 40%. So we've increased that, but we do believe that registering as an organ and tissue donor is a very important effort. We do also work with the federal government, and they do a policy initiative every 5 years, and that indicates that 90% of the American population supports organ donation, and if asked, would say yes. We encourage people to register as organ and tissue donors and give that wonderful gift. There are two sides to organ donation. We're hearing the fantastic stories of the miracle of people who are alive today because of that gift. There is the other side of organ transplantation, of individuals who've been personally touched, who've lost loved ones, but realize that their loved ones carry on and help others. I'm so happy to be able to introduce Carol, who we go to nursing schools and medical schools all the time to have this conversation. And Carol, thank you for your time today.
Good afternoon. My name is Carol, and I'm from Lynn, so about 19 minutes away from Revere City Hall. At the age of 16, my son Scott told me he wanted to be an organ donor. He wanted to have the heart on his license. And I remember saying, oh dear Lord, I don't even want to think about it. But we all did register and get that heart placed on our license. 16 years later, while enjoying a wonderful visit with Scott and his awesome family in California, our lives changed forever in a split second of time when Ethan, our beautiful 11-month-old grandson, was hit in the head with a limb of a giant redwood tree. In that instant, everything in our lives changed, our priorities, our values, our whole life. MedFlight flew him to Stanford University, where he had the most loving care. And for 3 days, we prayed for a miracle, that he would live and be the same little boy that he was that Saturday morning when he woke up. However, on the third day, the pediatric neurosurgeon asked to speak to us, the grandparents. and told us that Ethan was about to be declared brain dead, and that his mom and dad, Scott, and his wife, Andrea, had chosen to donate his organs. And in what was surely the darkest day of our lives, it seemed as if the sun came out. In what was surely like a rainbow coming out after a terrible storm, our broken hearts were filled with pride and joy. Finally, something wonderful would come out of this unbelievable tragedy we were living through, and that made all the difference. Unfortunately, no one needed Ethan's heart because of the little size. But his liver went to a little boy from the Northwest, and his 2 kidneys went to a 55-year-old man from Pennsylvania. In the period that followed, I realized one day that the same weekend that we were praying for Ethan to live, the families of those recipients were praying just as hard for their loved one to live. And our Ethan was the answer to their prayers. How blessed were we to have had him in our lives for that short period of time. I tell this story in the hope that if I can impress just one person with the importance of organ donation, then Ethan's legacy lives on. For in telling his story, Ethan has touched more lives in his very short life than I will ever touch in mine. I encourage everyone to consider organ donation and get that heart on your license. It can make all the difference, not only to the recipients, but to the grieving, heartbroken donor family. It doesn't take away the pain, but it definitely softens the sorrow and lightens their darkness. Thank you very much.
Carol, thank you so much for sharing that story. And you and I had a conversation before. You do so much volunteer work, and I say, oh, you know, I almost feel bad for you to have to share this. And she said, you know, don't feel bad. I get to remember my grandson in a very powerful and magical way. And there are people, young children today, alive because of that gift. So you've taught me a lot, Carol, so thank you so much. I also, and thank you again, Mayor, time is very important. I really appreciate you providing the time to do this. We have one more speaker today, again, a close friend, Liz Sandeman, who's a fantastic volunteer. She leads the Lions International Group on organ and tissue donation. She's here to talk about the wonderful work that they do. I do want to thank the Lions in general. They create wonderful materials to help educate the general public. This is in RMV offices throughout Massachusetts. It's in support with the state of Massachusetts, us, the New England Donor Services, and the Lions. They've also helped fund a driver's education video. Every student who goes through driver education is required to be presented information regarding organ donation. This artfully put together video is a 9-minute video regarding that, and all students get educated before they go to RMV of what actually organ donation is so they can make an informed decision. I really want to thank the Lions for sponsoring this and their continued support for this important cause. So Liz, if you don't mind saying a few words, I appreciate it. Thanks.
Hi, my name is Liz Sandeman. I'm thrilled to be here, and I am so lucky to work with such amazing people at New England Donor Services, all the volunteers. They're like family. It's just incredible. I'm fortunate enough to have just become the new chairperson of the Massachusetts Lions Organ Donation Awareness Committee. My story is that one of my sisters died waiting for a lung transplant. She was on the list for 4 years, and she never got that call. And so I know how important it is to get people registered. No other family should have to lose a loved one on the waiting list simply because there are not enough people registered. And as it's Valentine's, you can show your family what a kind-hearted, generous person you are by having that heart on your license, or by just registering. As Jim said, takes less than a minute online. It's so quick, and it's done. And I'm just thrilled to be here. I love talking about my sister T, who died. And she's with me every step of the way, whatever I do within organ donation. So thank you, Mayor, for having us.
Thank you.
And thank you.
Thank you, Liz. for sharing that. And again, thanks to the Lions for the wonderful work that you do, have done, and will continue to do. We really appreciate this. This event here represented literally the entire scope of transplantation. Those who are alive today because of it, those who've sadly passed away and helped save other individuals' lives, and those who were the result of an issue that there's not enough donors out there and passed away on the waiting list. Again, the idea is if you have a heart, please register as an organ and tissue donor. There is no effect on your health care. We, as the federally designated OPO, Organ Procurement Organization, are the only ones who can identify if an individual is an organ and tissue donor or not. Police, fire, EMT, doctors, nurses do a great job of one thing, saving your life, or in the police's and EMTs, getting you from one event to the other. They have no say in the organ donation forum. You are only considered to become an organ donor after you've passed away. Life is of paramount importance. Having someone die to save someone else's life is a zero-sum game, but if someone does pass away in a manner that's suitable for transplantation, you get these miracles in the back. So for those of you who may have not had the foresight to buy your loved one a Valentine's gift, I don't want to be flippant, but flip out your license and say, honey, honey, or whatever you call your darling, my heart is with you, and my heart's with others by registering as an organ and tissue donor. Mayor, thank you again for having us here at your wonderful house. It's a beautiful location here, sharing your story and creating this forum for us. So thank you so much to you.
We're going to close. We have one more thing to do, and I want Caitlin to come up with me. And I get this proclamation, which is a proclamation that I am today declaring February 14th, which is Valentine's Day, to be National Organ Donor Day in the city of Revere. And I wanted to present this to you, Caitlin, because of your story and the wonderful things that you're going to go on to do, and because of organ donation. So this is my proclamation, and so Valentine's Day is now officially National Organ Donor Day in the city of Revere. So thank you.
Fantastic.
Thank you. You're welcome, okay?